Hi, it's Micheline with Fit and Healthy for Yourself, and today is episode number 3 in my Alzheimer's series. And today I want to talk about how to keep Alzheimer patients occupied. Basically, Alzheimer patients are children. Children that you can't teach anything, and that really can't retain any information. So since you can't teach them anything, you kind of have to use the skills that they still remember, that they still can do. If your Alzheimer patient can still read, make them read the newspaper. Read the newspaper every day out loud. So as long as they can still read, keep using that skill. Because once they stop using it, they're going to forget it. So you can read the newspaper, you can do crossword puzzles. If they become too difficult, use activity books for children that have like little crossword puzzles and other puzzles in them. You can do puzzles to keep the memory going. You can do all kinds of games. If the person loves to play checkers or card games, try to still play those as long as you can. Because as long as they remember, they can do it. Once they forget, you have to move on to something else. I take care of an elderly lady now for 10 years with Alzheimer's, and she loved to knit. So as long as she was remembering how to knit, we pretty much let her knit all day. It was pretty much, in the beginning, it used to be still full blankets. As the skills slowly went away, the blankets only became little circles. And then you can see when they lose interest in it, you can give it to them and they just don't know what to do with it. Then okay, we have to move on. If they used to do something, keep that going. So what you also can do is, since remember, they pretty much are children, so build on that. Use what you would give a child to keep them active. You can go to Michael's, you can go all to these stores and really look for activities for children that are easy to do, that don't really require complex skills. You can do coloring with them. That actually works very well. As you can see, we did lots of coloring, and just like with children, we put them all up. So there are coloring books that you can buy. They're like $1 at the store, and you can still see the colors will soon go, and then they will only color with one color, and then they will start to color outside the lines, and then they will pretty much lose interest, and they just sit there and look at you. So, but that's something you can do. What we now have used, you can buy toys. We have bought a doll, and she loves talking to it. She loves taking care of it. We also have some stuffed animals that she likes to sleep with, and she talks to them. It's like a little baby because, again, they're like children. The memories are kind of gone. They're starting to hallucinate things. So the doll calms her down. When she's upset and she doesn't know, if she's looking for somebody, I give her the doll and she calms down. She talks to it. It doesn't really make sense anymore because she's starting to lose the ability to talk. But she's happy with it. So that's why if they love to go outside, they love to garden, let them do it. Even if they do it wrong, who really freaking cares? Just as long as they still do things, let them do it. So newspaper, coloring books, games, stuffed animals, checkers, whatever you can give them and keep them occupied, that's good. You can still watch TV, but don't just become a sedentary. Don't let them become too sedentary, because if they don't walk and if they don't keep active, they're going to lose that too. So I hope this helps, and stay tuned for my next one.